Dr. Shailaja ma'am. Hi, good afternoon all. Myself, Dr. Rupika, currently working as an assistant professor in Sanjeevini Ayurveda Medical College, Hubbali. Today is a fifth day on Astanga, and this wonderful session is based on the concept of Balaroga and Prasuti Tantra.
Good evening. There was some interruption. So some questions were has been asked in the session. So first question was if the patient is conceived and if she has the problem of fibroid, then she can continue the pregnancy or she should discontinue the pregnancy. That was the question asked by Shailaja. Okay, I think she is there or no, I don't know. So, but if the fibroid is interfering her pregnancy, then it should be discontinued. First of all, these uterine fibroids are asymptomatic one. If the hormonal imbalance is there, first of all, she will not get conceived. If it is not interfering with her pregnancy, then she can continue. And it depends on the site of the fibroid, where it is there. It is a intramural, submucosal, or subserosal. If any one of these is interfering with her pregnancy, then it should not be continued. In further conditions like in 5th or 6th month, she can abort that one, or the entrance of the fetal growth might be there. So it should not be continued. That is cleared by the question which is asked by Shashi Gowda. The second one, the difference, it differs according to the size of the tumor, means they ask the question that the line of treatment what I have selected, that the Ashokarishta, Varunadikasha and Kanchanara Guru, whatever the line of treatment what I have selected, that is given for the all the patients, that was the question, or it depends to the person to person. See, it depends to the person to person, it depends on the prakriti, which doshas is involved. So when I was telling about the treatment, line of treatment, I told that Samprapti Vigatanamiya Chikitsa. That is, you should see that Samprapti. Okay, we know that Granthi and Arbuda Samprapti is same. But which type of doshas are involved? Okay. If example, if the patient is which I have selected, the patient was lean, I would have not given the kshara. But if the patient is obese, then you can adopt the kshara, but it should not be for the longer duration. It should be in the shorter duration. Means we can't use shanat kshara. Means it will do the lekana karma. When it does the lekana karma, the ledana will occur more. So when you are giving the treatment, line of treatment, you should select the modality which is suitable to the patient. Okay, but the concept here, when you are treating the fibroid, the general basic line of treatment I will tell you, it should be Shotharak treatment. Whatever you select the drug, you can select any drug. Okay, you can select the Koumarabritya. Koumarabritya will increase the menstrual cycle. But here the Stambhaka Aushadha should be there, the Shotahara Dravya should be there. You can select anything, but whatever I have selected, depending on the quality of drug and the mode of action, I have selected and I have treated. Okay, this is the second question which has been asked by Vijendra Kumar. Okay, the third question which is asked was Prakriti of patient is necessary. Yes. The third question was asked by some of the delegate, that is prakriti of the patient is necessary. Yes, it is 100% it is necessary, because the patient prakriti and what doshas are involved, depending on the prakriti and doshas involved, we should select the line of treatment and we should treat them. Otherwise, what happens that we are selecting the prakriti one type and we are giving the line of treatment of different type, then it doesn't act, and the treatment line of, if it is acting also, the duration might be a more. That is the third question which has asked, and it differs from patient to patient and prakriti to prakriti. Then fourth one, basti is useful in the uterine fibroid they have asked. Yes, Basti is very much useful in uterine fibroid because here Vata dosha is the main positive factor for ovarian hormones which we require. So if you are treating for the Basti, it might be Anuvasana Basti or Astapana Basti, whatever the Basti you are giving, it should be given in a proper manner so that seeing the patient condition, seeing the diagnosing the patient prakriti, we can give the Basti. It might be Anuvasana or it might be Astapana, but we want whatever the Apana Vayu Dushti is there, it should be cleared out. That is the fourth question what was asked. And one more question was there that superfectation was the answer what they have asked. What is the reference of superfectation? That is, what do you mean by superfectation means if the patient is conceived, okay, if the patient is conceived and it is told in Charaka Sharirasthana, second chapter, 14th quotation, okay, they have told about this reference. The person they have asked about the reference where we will be getting this superfectation reference. So in Charaka Sharirasthana, second chapter, 14th to 14th quotation, when you go through, they have literally told about the Bahugarbhata. Bahugarbhata is nothing but the multiple pregnancy. What you are asked, it is about the multiple pregnancy or twin pregnancy. They have told about the Bahugarbhata, means the Vayu, whatever it is there, it will be dividing the Bija into two parts. Okay, that is uniovular or biovular twins. That also they have told in the Samhita that two ovulation will be occurring in the same ovulation period. Means in the same cycle, two ovulation will be there in different time. That is once in the fourth day might it occurs and they have conceived at that time, or they have done the coitus or intercourse at that time and they have got conceived. Once again on 16th or 17th day, without their knowledge, they have done the intercourse. At that time also, the ova has been released, and that time also it has been conceived. This is called as superfectation or superfecation. So this question was asked in the YouTube, that also I have cleared it. These are the few questions which were asked in the YouTube, so that I have cleared. One more question which I have read in the chat, that a 32-year lady was there and she was eager to get conceived. In that patient, if she is suffering from uterine fibroid, we can give the treatment or we can use the Kshara or no, they have asked the question. So yes, 100%. If she is planning for the conception, before conception, we can give the Shodhana and we can try for the Kshara, but not for the longer duration. You can give for short duration of Kshara, and that too important. What is the size of the fibroid? The size of the fibroid, it all depends. So if the size of the fibroid is there small in nature, then no need to give Shara. We can go whatever the line of treatment I have told. If the size of the fibroid is bigger and the person is hefty or obese, then 100% you can use the Kshara, and after resolving the fibroid, uterine fibroid, at that time only she can get conception. Otherwise, if totally it has not been resolved, and if you are giving the or you are trying for the conception, then it is not of use. So why? Because once again, if she get conceived, there might be a chances of getting abortion or miscarriage. So thank you for patience hearing, and the most of the questions I have cleared from my part. Thank you. Saitra, good evening, sir. A patient has undergone abortion. Does the fibrocyst formation occur? If it occurs, does treatment remain the same? So fibrocyst, okay, if the abortion is occurred and after abortion, you can give the same line of treatment, whatever I have told, okay, or you can use the Kshara also. And one more question was there, what I have read during this question, one more question was there, that the same line of treatment is used in the fibroadenoma or in the fibroid. So yes, we can use the same line of treatment, but you should see what is the size, and you should go for the FNAC, that is fine needle aspiration test you should do. Then you can give the treatment. And one more question was there by Hemlata, Dr. Hemlata, that can we give the pre-cancerous treatment? What is the line of pre-cancerous treatment? Okay. Naimetika Rasayana, the Rasayana treatment we can adopt after the pre-cancerous or before going to the stages of the TNA staging if you are doing. In the pre-cancerous stage, we can give the Naimatika Rasayana or the Rasayana therapies, whatever they have told in classical test, that we can adopt. Okay. These, I think all the questions which they were asked in the session, I have cleared it out. So thank you.
Thank you all for the patient hearing. I think all your doubts got cleared. And tomorrow we have a Astanga Ayurveda on the day, and we have a session on the Agata Tantra. Okay, and the session will be going to delivered by the Dr. Anjana Sitapur, and the second session is going to be conducted by the Dr. Gopi Krishna. Thank you.